Guys, welcome back to the channel Basic Home First Aid. Today we'll be looking at the first aid measures needed to manage a heart attack. A heart attack is a medical phenomenon most commonly caused by a sudden obstruction of the blood supply to part of the heart muscle. It can also be called a myocardial infarction. The effects of a heart attack depend largely on how much of the heart muscle is affected, and the main risk is that the heart will stop beating. However, many casualties recover completely. Some recognition signs for an individual having a heart attack include persistent tightening central chest pain, which may spread to the jaw and down one or both arms, breathlessness, discomfort occurring high in the abdomen, which may feel similar to severe indigestion, collapse, often without any warning, sudden faintness or dizziness. The casualty feels a sense of impending doom, blueness at the lips, a rapid, weak or irregular pulse, profuse sweating, as well as extreme gasping for air. Our main aim in this situation is to ease the strain on the casualty's heart by ensuring that they are at rest, to call for urgent medical help without delay or transfer to the hospital immediately, to identify if the heart stops beating and to start CPR immediately. Heart attack is a common occurrence, and there are only a few things that the non-medical person can do for the victim. These few things, however, may be very important. They include putting the patient at rest in a chair, couch, or bed, and ensuring they are in a calm, unagitated state. Relieve the pain using aspirin, whiskey, or any other common pain-relieving agents readily available. Alcohol is good because it relieves pain and calms the frightening, agitated patients. Send for help and avoid moving the patient until help arrives. While waiting for help, monitor and record vital signs, which include the level of responsiveness, breathing, and the pulse. Ensure that the patient is transported to a hospital. Do not move the patient about or let them move himself about. Keep them quiet. Do not force them to eat foods, and liquid should not be given unless in very small quantities as they desire. And finally, do not apply artificial respiration or give stimulants such as caffeine. Myocardial infarction may cause the heart to stop pumping blood. This may happen in one of two ways. The ventricles may simply stop beating and hang motionless, known as ventricular standstill, or the ventricles may go into a feeble twitching motion which cannot pump any blood, known as ventricular fibrillation. In either case, the patient will fall as though shot. He will be motionless and he will not breathe. They are not dead, but at this point, the patient is not breathing and their heart is not beating. In 3 or 4 minutes, the cells of the brain will begin to die for lack of oxygen. Whatever is to be done must be done at once. To treat the stoppage of the heart, make a diagnosis as the first step. The diagnosis of heart stoppage rests on 2 simple observations: the patient not breathing and the patient not having a pulse. A hand placed on the chest will help detect very slight breathing movements. The pulse is usually taken from the wrist or the neck. It is, however, a skill that most people do not possess. Having concluded that the heart of the casualty has stopped, the next step is crucial and life-saving, and it involves cardiopulmonary resuscitation, also called CPR. Watch the video on the link above in order to learn how to do CPR effectively. Thank you for watching this video. Hope it helps someone out there. If you want to know how to easily get the pulse of a victim, let us know in the comment section below. Don't forget to like this video and subscribe to our channel for more life-saving videos. Stay safe and never forget, if not you,